Welcome everybody to this evening's Harveys Gang webinar. I'm Penny Fletcher. I'm the Public Engagement Manager at the Royal College of Pathologists. My colleague Tadsha and I will be doing the behind the scenes things for the webinar. I just want to say a huge thanks to Malcolm Robinson for doing this webinar for us, and it's going to be a fantastic session, and I hope you have lots of questions for Malcolm after he's given his talk. So I'm going to pass straight over. Thanks, Malcolm.
Thank you very much, and good evening everybody, and thank you very much for your incredibly valuable time. It's very much appreciated listening to an old man speak. Who am I? Well, I'd like to talk to you about Harveys Gang and what it is, where it is, and how to go about getting it up and running. Who am I? Well, my name is Malcolm Robinson. I am now a retired biomedical scientist. And before I retired, I was the Biomedical Scientist of the Year 2018, which I'm incredibly proud to be. And also was in the top Power 100 for 2 years on the trot after I retired, which was amazing, and champion of biomedical science in the Southeast. I'd like to tell you a story about a boy that inspired me. His name was Harvey Buster Baldwin, and he is my inspiration. Harvey and I met a few months after he came into hospital. He came down the South Downs when we had snow down in Worthing, and felt a little bit unwell just coming down the hill once, and they took him to GPs, and GP said, oh, he looks a bit pale, take him across to A&E. And he went there, they took some samples, and as usual, they said, come back in 2 weeks and go to your GP and the results will be ready for you. They got a phone call at home that evening, and his hemoglobin in new money was 36. And they explained that he needed an urgent transfusion that night. And that started his healthcare journey. But he was a young lad of 6 that asked so many questions. He drove the pediatric nurse, the staff, the pediatric nurses, pediatric consultants, the hematology consultants, absolutely nuts with the amount of questions he asked. The pediatric specialist said, Malcolm, we've got this youngster with lots of questions. Any chance he'd been able to show me around and answer some of his questions? So we did. This is him and I, a little me, and he was in the smallest lab coat that we had, and that came down to his ankles. And you can see there some of the petechiae and discoloration around his neck, and he'd started chemotherapy, started losing his hair. And he started his healthcare journey with Worthing, and he shared it with the Royal Marsden. And he had a bone marrow transplant with the Royal Marsden and total body radiation. And there he is pictured with his brother Max, who was 14, and he was the bone marrow transplant donor. And at 14, I think that's quite incredible. And if that was to music, it'd be something like He Ain't Heavy, He's My Brother. And the two of them were inseparable. And he went on his journey, and we didn't see him for quite some time. We'd explained what happened to all his samples coming around the laboratory and where they went, why they were in different colored tubes, why they had to be labeled correctly. And he did the same up at the Royal Marsden, asking all sorts of questions up there also. The Royal Marsden didn't give him a tour of the laboratory, but he became the postman. So he went round the post every day, asking all the patients what occupations they did, and talking about being lorry drivers and postmen and things. He was just one of those inquisitive youngsters. Luckily, we didn't see him for 12, 14 months, and we thought everything was great, and we were very pleased. Then he started to come back to us, and unfortunately, it was, as is usual the case when you get these patients, they tend to be very sad. And he had his last transfusion on a campsite in Devon, where he had his farewell with his family. Derriford kindly arranged that, and he passed away. I was asked to, whether I wanted to go to his farewell at the crematorium, and they put this music up on the wall with me and him, and I couldn't understand it. No idea why. Why would an 8-year-old's farewell include me. What had I done? I'd given him a tour of the laboratory. I hadn't done anything else. So I thought, I'll have to hold that music there because I couldn't handle any more embrace. It really does still get to me. But at his farewell, Richard and Claire, his mum and dad, said to me, Malcolm, we got no idea what you did. Thank you very much. And I went, I've got clearly no idea. And they went, well, you explained it to Harvey. Harvey left us with his white coat, walked through the hospital, lording it over doctors and nurses he came across, explaining that he was a scientist. He got back to the ward area with his cardboard identification and took it out of its holder and put it through the card reader. And we all know that that probably wouldn't have worked, but a nurse on the inside luckily saw him do that and pressed the bell and the door opened. And that opened his life about being able to explain everything that he'd learnt in the laboratory. And if ever he came across a question that he couldn't answer, he always had an email address that he could fire off an email to and ask that question and get an answer from myself or one of the team. It was quite moving. And the consultant pediatrician said, Malcolm, he said, you've got no idea, it was fantastic. And I've got another 7 kids that could do with the same sort of tour. Oh, says I. And I got taken to the pub for some liquid refreshment to get over that shock of losing Harvey. And we came up with the idea of Harveys Gang, and we needed to reflect on what we did well and what we didn't do so well. Well, the lab coats, that was the first thing. We needed smaller ones that fitted children. And that's what we did. We got hold of some coats. We started initially making our own using threadbare NHS sheets, and our chief BMS in haematology was making them for us. But we started a few tours, and overnight we thought about Harveys Gang. And 7 days later, we had a pilot with a youngster, and Ortho Clinical Diagnostics very kindly got on board after I explained what had gone on and gave us some goodie bags and some pens and some crayons and books, etc. And we named our first ortho vision, which was the first in the world at the time, Harvey. So in Strasbourg, it is known as Harvey, not by its J number. So we launched Harveys Gang, and since then we have been doing what I consider to be incredible things. We started in Worthing, and then Chichester, our sister hospital, then further afield to Southampton, then Portsmouth in Kent, London, then further afield. And we've just started to expand. We've got youngsters coming into our hospitals, joining our biomedical scientists and our teams of various healthcare staff to look around the laboratory to understand what happens to the blood samples that they put into tubes and label, why they get taken so often, why they're different colors, why it's important that the samples are labeled. If we empower our children to have samples labeled correctly, we wouldn't have an issue of having our samples labeled correctly when they come to the laboratory. But also from biomedical scientists' point of view, it means that we no longer complain so much about a half-filled tube in an ETTA, as an example, with a little bit of blood on the outside, because we've seen these youngsters and how they struggle to get samples taken sometimes. Whereas actually, we've got more of an idea now of that journey that samples and that patient's undergone. And we do risk assessments for patients when they come around. So we know whether they're at risk or not at risk of anything that they're going to come across. And we give them our PPE, appropriate PPE for whatever they're doing. And we look after them as one would expect. They look into centrifuges and they see them spinning around and quite amazed at how fast these things go. Trying to explain them the speed compared to a rotary Wankel engine that Mazda produced, and mum perhaps going at that speed would be actually speeding and might get a speeding ticket. Looking down the microscope, and if they've got a current sample or one reasonably previously, we're able to get that slide out and show them down the microscope at their own cells, so they can actually see what their own cells look like, which is remarkable. It's a team effort. We are a team, and for years, the laboratory doors there are security sealed with level 9 or above security. No one shall get past them. They're very secure. However, people don't know we exist. Actually, as we all know, 70 to 80% of all diagnoses are made because of the stuff that we do in our laboratories. Well, let's shout about it. All of a sudden, we're now becoming a lot more visible with the patient. And our teams are within all the laboratories, not just blood sciences or transfusion or microbiology, it's all of them. We've got a lot to offer all of our areas. We're a team with people outside of the laboratory. So we come out of our laboratories and go to meetings with them. So our pediatric nurses and pediatric play specialists, our oncology teams, our trust security to get the ID badges, our trust porters, vital small cog in the wheel, but without which none of us work properly. Our trust communications teams to shout about what we do, not only locally, but in the press. And our executive team also really start to appreciate what we do. Now, and as an example, Harveys Gang was mentioned 5 times in our outstanding CQC report. And all the inspectors, 48 of them, wanted a 1-page report to take back with them. Amazing. But not only that, we're also being on the television to share our stories. And here we've got a young girl in Edinburgh that had her tour, Bella. And I actually went up to Edinburgh in February 2020 to present with Bella to a hematology and transfusion audience. Very articulate young lady, thoroughly enjoyed her tour and was able to talk about her disease and her journey through healthcare. And there are more videos available on YouTube as well to look at. I apologize in the words of Kevin Bacon that I lied to you. There are 115 gang sites. Well, it were when I wrote this site on Monday morning. However, we're now up to 116 and we grow all the time. It's amazing. The tours are continuing. So what does it mean? Who are we? What does it mean? Well, to patients, it means they get their questions answered. We can answer some of the questions that they've got. They can look at their own cells. They can see the difference between blood, platelets, and fresh frozen plasma, be it thawed or be it frozen. What does it mean to parents? Well, parents sometimes get samples taken that they say, well, they're done urgently, but took 2 hours. The week before, it wasn't done urgently, it only took an hour. Where you explain to them, well, depending on the time of day and the GP workload that you might receive, and everything goes in a queue, regardless of it being so urgent through the IT system that inevitably takes delays to get the samples back, to get the results to them. What does it mean to us? Well, all of a sudden, we start to be recognized as part of the team in the trust. People know who biomedical scientists are. We come out of our shell and we come out behind the solid walls to be glass doors and glass walls for people to actually see who we are. Very special young man. This is Toby. He launched it at Chichester and he came round in a wheelchair. He had a heart valve failure and he needed a new heart. Luckily, he was feeling a bit better because he'd had an artificial heart valve placed and he launched it at Great Ormond Street for us. And the picture on the left now, regretfully, I know it's very sad that somebody had passed away, but somebody luckily donated their heart and he is now powered, as it says there, by a donated heart. And he was the flag bearer for Great Ormond Street at the transplant games. Fantastic story. But not only the story there, Zoe and myself, as biomedical scientists, actually went up to Great Ormond Street when he was having his surgery. We couldn't see Toby at the time because of his procedure, but we spent a couple of hours with his parents talking, just being there for them. We're one with the patient and the patient team. So it means a difference. We are a team, not just the people within the laboratory. It's outside of the laboratory, nurses, transfusion practitioners, doctors, nurses, A&E staff. This week, National Pathology Week was fantastic. And this is a young lad at St Mary's in London. And he's had a Harveys Gang tour this week. He's pictured there in the middle holding 2 bags of blood, which had been sanitized for him to hold. the following day, he received both of those units. He was a Diamond Black fan. And it's remarkable. We're starting tours again. It's been a long, very difficult COVID period for everybody, including the young patient. So how do you start? Well, find us online. Follow the link tree there, my email address. Let's sit and chat. I'll email you. I'll go through things. I'll ask you for things too. I'll need your postal address, your courier address, and if you're in England, your NHSBT Pulse delivery address. And I'll send to you Harveys Gang coats and Harveys Gang goodie bags. I'll send to you by email editable forms, a Harveys Gang application form, which goes to the parents to explain what it is. But it also explains to you about the patient, if they've got any woes, concerns, worries, needle phobias, what's wrong with them. So everybody knows what's wrong with the patient before they come. So you've got an idea to do some background reading beforehand. Attendance certificate, which can be tailor-made to the youngster when they come around. So it's a permanent reminder of the day that they had a very good day in hospital, because some of these youngsters don't have good days. There's risk assessments. It might not be perfect, but it's a start. It's editable. You take our details out, you put your details in, and you upgrade it as per necessary. We're so used to doing risk assessments now, so it's not quite so bad. We've been running now since 2016 as a charity. We are at 116 sites, which is fantastic. It's amazing. It's free to healthcare professionals. We don't charge anything. We do ask if you could do a bit of fundraising to give back, but it doesn't cost an NHS trust a penny, apart from a bit of effort, a bit of time. But I can guarantee you, on the day that you give a Harveys Gang tour, you will leave feeling 6 foot tall and 6 foot wide and very, very proud. I would like to say thank you for listening to me. I hope I've made you stop and listen and think, and maybe want to bring Harveys Gang into your place of work, or go out for a run and think, well, actually, I could do a bit of sponsorship at the same time. But where do we want this to go? Well, I personally think it should be a part of children's healthcare. If they get diagnosed with something that they need blood samples, why not give them a tour, show them where to go? Potentially in future, we're building our future workforce, an educated and empowered workforce from the get-go. Thank you very much.
That was brilliant. Thank you, Malcolm. Really inspiring. And we've got a couple of questions coming in. Do feel free to add any more questions for Malcolm into the Q&A area. Should we start with those? I've also got a few questions as well. Yeah, really interesting talk. So I don't know if you can see those in the Q&A there, Malcolm. What advice can you give if we have a BT lab which is privately run and we want to have a Harveys Gang in the trust?
Well, personally, I would say that a privately run laboratory would also want to join in. They would want to be seamless with you to provide one service. Just because they're privately run doesn't mean they want to walk away from this, because it would be fantastic PR for them also. And it's a great way of being actually crossing over that boundary to have a chat with them, get to know them a bit better, and actually bring them into your field, and maybe have a better communication between the two laboratory setups. When we set up in Nottingham, and I presented a few years ago, Nottingham turned around to me and said, "Thank you, Malcolm. It's the first time that hematology and chemistry actually talk to each other in 6 years." So yeah, that's the way to do it, I would suggest. Brilliant.
Okay, thank you. Two questions about expanding Harveys Gang tours. So histopathology and cell path. There's a cell path BMS. Have they also gone ahead in histopathology labs?
Yeah, the histopathology do enjoy being part of it as well, and there's no reason why they can't. Yeah, they see tissues, and then they pull off a floating piece of tissue and then stain it on a slide and look down the microscope and see cells. kids love to see things down the microscope, and getting it explained to them what the nuclei look like and what various types of cells are down the microscope is fantastic. Yes, they would love to. Microbiology is another one we don't see very often, but some of the non-septic kids love to go into microbiology or see it from a distance. And we had one who had, it was Christmas, and we didn't have the microbiology laboratory on site, but they knew that we were having a Harveys Gang tour. So they grew a Christmas tree with E. coli on a chromogenic agar, and the baubles were group D streptococci or enterococci, as the red dots as part of baubles on a Christmas tree. They printed it and in color and then signed it, and we gave it to them as a Christmas present to the youngster.
That sounds brilliant. So there are histopathology labs that do these tours, and they can get in touch with you if they haven't got them yet. Is that right?
Yeah, indeed.
Yeah. Okay. Do you let the children take their lab coats with them, and if so, how do you replace?
Yes, we do. The whole idea of the Harveys Gang coats and the goodie bags these are for the kids, for the tourists, and there are two trains of thoughts. One is that they wear the coat and then they take it home and wash it. However, there's another train of thought that they wear one coat and we wash it and keep it for the next tour, and we give them a brand new one of the same size to go out. Now, some of these youngsters actually go out of the laboratory still wearing the coat and don't take it off. They'll go for lunch in the lab coat. They'll go around town in the lab coat. And the two twins pictured in the presentation there took dollies home and started dissecting them at night, both still in their lab coats. So yes, the lab coats are the kids, and they are very special.
Oh, they're very smart. Yeah, I can see why they want them. They're lovely.
Yes.
Great, thank you. So another question here. So actually somebody that's already doing the tour. So great to hear how well it's all going. We're still on pause here at Southampton. However, cannot wait to start our tours again. We're doing more than one a week at times. You can see the huge difference it made to the children and also to our staff. Keep it up and we'll keep you updated. So yeah, I guess there's some that are not restarting yet. Is that right, Malcolm?
Yes, it's, you know, this pandemic's been very difficult for everybody under very difficult circumstances, and you know, various hospitals have got various sort of issues still about bringing patients in and patient relatives, bringing them into hospitals, etc. So most of the tours still are on hold, but as I say, you know, two have started this week. Guernsey started in August last year, which was the first last year, and they were COVID free at the time. And they were a new site, so they actually started last year, but have been on hold ever since.
And I saw in your word cloud places all over the world. Is that right? There's some in America and
we've started Harveys Gang in USA. We're not really gone too live there at the moment. They're trying to set up as a separate charity because the healthcare is a completely different animal over there. We're in Toronto in Canada. We're in Tasmania in Australia, and as of 2 weeks ago, we're going to Queensland in Australia also.
Wow.
So yes, we are in other places.
Fantastic. Has anyone set something similar for adult heme patients? Do you think it will work equally well for adults? Asks somebody.
Personally, I don't see why not. You know, years ago, we used to give our patients in a particular area, older patients, a tour round of their hematology area where they got looked after on a regular basis. I don't see why it can't be rolled out to adults. However, at the moment, I'm just concentrating on children, but I don't see why not. We provide Harveys Gang coats from size 26 inch, and as you saw on some of the youngsters there, the smallest 26 inch, all the way to the proverbial fat person, myself, size 52 inch. So, you know, there's quite a range of coats already, and you know, we don't do children routinely at the moment, do adults at the moment routinely. However, there's no reason why they can't start expanding and build it from there, and then, you know, they might get some children coming in as part of that.
And I guess you have sometimes other parents coming with the children, or you just take the children around without them?
The children or guardians come round, and it's absolutely fascinating to hear some of their stories. Francesca, when she came around, when we launched Harveys Gang, she had Fanconi's anemia, and her question to me at 8 years old was, Malcolm, do you ever think we'll grow solid organs from stem cells? And I went, good grief, what sort of question is that? It turned out that her dad had factor V Leiden and was on his second liver transplant. And so they go through a hell of a journey, and it gives the adults as well a chance to ask questions that they've got questions about. And we're the people that know. Doctors and nurses can't really answer some of the questions that biomedical science and healthcare scientists can routinely answer very easily, about turnarounds, about times, about the fill of the sample, etc.
Absolutely, and I guess everyone really has their blood is tested at some point in a hospital laboratory, isn't, you know, everyone has routine tests as well, so it's not just those that are in hospital.
Because as part of that discussion also, they might say, oh, you know, I had the flu vaccine the other day as well, how does that work? You know, and you start then talking about the response of your white cells. And so you can say, well, actually, if you look down the microscope here, you can see some of the lymphocytes, and they may well be as a result of something like a flu vaccine.
Great. We've got a really nice comment from Deborah. Malcolm, that was a wonderful showcase of your initiative that pulled on my heart. It's how lovely to see the engagement from staff, families, and the children that benefit. Many congratulations. Yeah, I mean, I was going to ask you actually, Malcolm, about the sort of benefit for staff. I guess there's lots, there must be many, and you must have spoken to lots of staff that now do these tours that really benefit from that.
Yeah, I mean, you know, I'm not saying it's easy. You know, have got to put a bit of effort in to make sure that the tour goes well. And sometimes it's done and you might end up, you know, missing out on half a lunch break or a tea break, or having to work later in the day. But you don't mind, because most of the day you're floating on air, feeling 6 foot tall, thinking about that young person and their family, or some of the comments they made, or some of the questions they had. And that stays with you. And next time you see that sample, you think, oh, yeah, I remember that patient, you know, and miraculously, that sample goes from the back of the queue very close to the front. It remarkably how quickly their samples go through in future.
Question from Ruth. How many staff members from the lab do you need to be involved in for coordinating a Harveys Gang tour?
Okay, so myself as an example, going around our laboratory, I tended to coordinate it. I used a senior in hematology who was excellent on films. If he was free, if not, then I gave him a look round. I used a senior or a BMS in the coag area to give him a look around about the machine. If not, then I gave it. And in chemistry also, I gave, you know, a senior BMS in there to show around the, if not, I did. You know, it was the opportunity to bring other people in to make them feel better, and it worked very, very well. We had one youngster say, oh, I've just been prescribed magnesium for treatment. I've got no idea why. Do you know? And I went, no, I don't. We're just about to go into chemistry, and I bet if you ask the young lady in there, she'll be able to tell you. And he said, and do you get leg cramps? Yes. Well, there you go. That's why you give magnesium. Easy answer. And I learned something on the day. So yes, it's a learning curve for everybody, and the more tours you have, the more people want to get involved, they want to join in, and it is incredible CPD. You know, we're at that HCPC time now for making sure that we're up to date with our CPD. This is a huge piece for your CPD, because it brings patients in to your environment, and it's not just about learning from a book or learning from somebody on a PowerPoint. You actually learn from a child or a parent, and you learn about other things. About one of the families required genetic testing. Dad went to London first thing in the morning. How the hell do you get all the samples taken on the same day to get them to London? Well, you just open the laboratory a bit earlier. So we opened the laboratory, and the phlebotomist came in at 5:15 in the morning just to take the samples of all the family, and they were on, all the samples were on the same train as Dad going to London. That's what we can do in pathology if we communicate. A lot of the time, nobody talks to us.
Yeah, so and in terms of sort of senior kind of buy-in, is that something that you can help with or advise on, or is that not necessarily an issue?
I can certainly help and advise. However, if I'm honest, it's a no-brainer for management side of things, because they see the positivity out of this. They see the local press they see the film crews coming around taking some of the films, etc., and see the local newspapers, it's a no-brainer that it puts the whole laboratory in a positive light. And people then start hearing about, laboratory personnel, biomedical scientists, healthcare scientists, the hematologists and clinical chemists, etc., etc.
Yeah, that's a good point about PR. I guess the hospital, the trust comms team gets quite involved today when there are these tours and things.
Yep. I mean, we've got our own, trust communication forms that we use, which we had from our trust communication team, just to make sure that we can use the stories and the pictures. And if they say no, that's also fine. We don't have to use all the stories, but it is great if we can, because each story sells us, the tours to other people, and it sells it to the local people that your hospital is doing so much for the local community.
Definitely. A couple of questions about microbiology labs. I think you touched on it a little bit, but how I was saying, assuming it'd be too high risk from a lab safety perspective, any thoughts in terms of doing tours in micro labs?
The risk is the health and safety of the youngster, and a risk assessment. If they're neutropenic and potentially septic, then obviously that's a probable no at that time. However, if there's no neutropenia and there's no open wounds and there's no IVs, etc., and they are suitably gowned and masked and gloved with glasses, etc., there's no reason they can't look in from a distance. They may not be able to open micro agar plates, etc., to actually sniff the bacteria, etc. However, there's no reason why they can't see a difference. Or even having a video camera in the laboratory, so they actually watch it from a big screen on the outside of the laboratory and feel as if they're involved.
Yeah, I was going to ask about cameras actually, because I think that'd be a nice way, wouldn't it, of microbiology getting involved.
Yeah.
If health and safety is to just link to that, I'm kind of jumping around with the questions a little bit, but somebody's asked, on health and safety perspective, whom do we get clearance from for that?
Well, certainly we went through the trust health and safety team and infection control, and they were very, very good to say, actually, we haven't got any issues, there's hand washing. And this is another great example that kids can teach us so much more about hand washing because they're so much better at it, because they have to be, and they can teach us, and it empowers them that they're actually getting something out of it, passing some of their knowledge over to us. And getting them, the health and safety and infection control team on board, they can have a look around. And that's also good now and again to get infection control into the laboratory to make sure that actually we're doing well with our sharps bins and our access points are better. And sometimes they can actually have a lot more power than we do to say, actually, that's not good enough there. This isn't a very good route through the laboratory, and get something done about it. Whereas we've been possibly complaining about it for years and hitting our heads against a brick wall.
Great. So loads of really nice comments as well. So Claire, Michelle and Cardiff were still on hold doing tours. So their first tour was postponed due to COVID. And they're doing a whole pathology, blood transfusion, heme, biochem, histology and microbiology. So they're going to do all of the pathology labs, which is great. And I'm sure you've got other examples, Malcolm, that you know of where there's sort of different approaches. I don't know if you wanted to mention any in particular.
Well, we had one of the tours that was in Kent, and Caitlin went into the microbiology, and she had Ewing sarcoma, and she knew Harvey from the Royal Marsden, and she walked around the microbiology department even with the Ewing sarcoma, and they knew she was coming, and actually grew her name in on chromogenic agar, which was made her day. And since then she's gone on to make a lot of publicity for Ewing sarcoma, and she was in the Britain's not Got Talent, the one, Pride of Britain Awards, where she met Fleuris. So she got an award for Fleuris for the amount of fundraising that she'd done, and she was able to talk about what she'd seen in a laboratory, which is remarkable. Who would have thought?
Brilliant. And you might know some of these people that are asking these questions. Loved it. Thank you for making me cry again. Harvey was lucky to have you in his corner. Long live Harvey's legacy. And it is such a great legacy. It's his family you must still be in touch with the family, are you? Harvey's family?
Yeah, Richard and Claire are very much involved. Claire is a trustee of the charity, and we virtually meet now on a monthly basis as opposed to meeting, and we're still sort of keeping it going, trying to figure out how we go. Yeah, we're not experts in running a charity at all. Yeah, all we try and do is raise a bit of money, raise a bit of awareness, so we've got enough money to get the Harveys Gang coats supplied. Because for me, it's about standardization of the tours, so these can go out to anywhere and it's all standardized, because that's who we are. We're a group of biomedical scientists, healthcare scientists that are used to standards and standard operating procedures. If everything's standard, we know what we're doing and we just roll it out, and we're able to roll it out, quite easily from there. And all we need to do is make sure we've got the coats there to keep it all going, and hence the fundraising to be able to do that.
Yeah, so in terms of the fundraising, is there a way people can get involved, or
Yeah, we've got a Just Giving on the link tree. We've got a Just Giving page link there that we very kindly ask people to use and raise money. We had a young man who was the son of an accounts person that helps us with the accounts, who ran the Brighton Marathon and raised £1,500 for us, which is fantastic. I mean, £1,500, because we're a charity and we've ticked a lot of boxes with a lot of people. We found a food company that produced the white coats for us now. So £1,500 gets us 100 coats. So that's another 100 youngsters coming around the tours. So yeah, we don't need a huge amount of money. It's all very much appreciated, and we sort of put it all back.
Brilliant. And how many of you run the charity?
There are 4 trustees in total. It's my wife, myself, Claire, and a young lady we call Kaylee, who's just got married, and she sort of does some of the writing for us. So it's 4 of us. Most of the running around and everything else is done to me, which is what I do now in retirement.
Goodness, that sounds like a full-time job. So yes, not really retired, but it sounds like you're so passionate. It must be.
It's something I firmly believe in, and I won't let Harvey's legacy go, unless I can sort of pass it on to the next generation of people to take it forward for us. There's a long way to go.
Yeah, no, it's fantastic. The achievements so far are incredible, considering it was 2016 that you became a charity.
It was 2016. Harvey passed away in 2014, and we launched it in November 2014, 1st of November.
Okay, you've been a charity since 2016.
Yeah, so the first 2 years we were finding our feet with pilot studies, making our own coats, etc. And then it started to take off, and there was just no way that we could sort of make so many coats. We needed to find a way to do something about it. And running a charity and forming a charity is something I've never done. So that went into my CPD folder as well, because it's something that I learned from.
Brilliant. So you might know of Paul Jakeways saying his Harveys Gang's most wonderful thing is starting off in childhood is my proudest achievement as a BMS. Thank you, Malcolm. So yeah,
that's fantastic.
Great testament to kind of how rewarding it is to get involved.
Yeah.
And Anwen says, I remember Francesca giving a mind-blowing talk at a Southeast event. Such a brilliant initiative and such a knowledgeable young lady. So this is one of the young people.
Yeah, this was Francesca that launched Harveys Gang on the BBC down here for us, and she was the one who asked us a question about solid organs. My nickname for Francesca is Professor, and still is, and even to that today she's still asking questions. And she's a straight A student that wants to, originally was going to become a doctor. I named her Professor, so she's on that way, but she wants to do genetics, which is fantastic.
Wow, how old is she now?
She is now 13, and she is representing England at what we call Bulls.
Oh yes, kind of like where you throw the ball. Yeah.
So
very good.
She's representing England at that. So yeah, it's really good, and she's still doing really, really well at school.
That's good. And Sharon says, thank you, very impressive and informative for us to use to help start up our own Harveys Gang, hopefully soon. So yeah, Sharon, do get in touch with Malcolm. So we'll be sending around all the link tree that with all of the different sites for Harveys Gang. We'll send that round with a feedback form as well, just for this session. So yeah, and if you do have any final questions, we've got a couple of minutes, but I don't know if you could just share your screen again, Malcolm, and we'll just finish off with a couple of slides. But no, thank you again. It's been really yeah, brilliant to hear about the Harveys Gang story, and thanks everyone for your questions and comments as well. So we just kind of skip down to wherever your slides end. Yes, so I was just going to say it's National Pathology Week, and it's running until Sunday. So if you're in a hospital, please just get involved on social media. If you haven't got a kind of stand or anything, just hashtag Pathology Week. Get involved in our Twitter competition. We're running a Twitter competition. So if you post a video or a photo of you and your team, you can enter our competition to win a £100 restaurant voucher for you and your team. And the final slide is just a list of our social media. Again, that will be in the I'm going to send you shortly. Or there might be one more comment come in Q&A. Oh, Janice saying thank you, truly inspirational. Okay, well, thank you again. Did you want to say anything as a final comment, Malcolm?
All I can say is thank you very, very much for your time this evening. Very kind of you to give it up for me. Please go and change the world. I'm here to help.
Great note to end on. Thank you so much, everyone. Enjoy the rest of your evening.
Thanks very much.
Thanks. Bye-bye.